symptoms that are life-threatening. The day-to-day experience of people living with lupus will leave many powerless. Just imagine a life where your body constantly attacks itself. Health Nugget starts now. My name is Aida Munzati. Today we shine light on this condition, but first, let's have a look at these incredible stories from these lupus warriors.
I'm an African woman. I am a mother. How do I tell people I am tired? How, on earth does somebody understand that me, the big woman in me, I am not waking up because I am tired and I did nothing yesterday or the day before.
Many of guys thought that this maybe is a witchcraft because something that is not understandable.
There are pains which zinaua, wacha tuseme.
I used to have stiffness on my elbow and neck. When I went to hospital, most of the time, they could not understand what was happening because they thought it was a malaria. At times, they tell me this is a malaria, something like that. So it went like that till 2010. That's when I was critically ill. After thorough research, I was diagnosed with lupus. Actually, I didn't understand this disease because many of guys thought that this maybe is a witchcraft because something that is not understandable. When I did my research, I did a lot of research and I found that this is something that cannot be, I was really shocked, and we found that this is something that cannot be treated but can be managed. And my wife really supported me during that time. At first, most people used to say that this guy akona HIV. Yeah? When I went to hospital, everybody wanted to see what's the result, because if you go for treatment, the first test they used to do is to test for HIV first. Then after that is when they start testing other things. So most people thought that this guy has an HIV. Yeah. Lupus, I normally ask God just to give me that good health, because you wake up when you are okay, then the next minute was somebody who is not feeling well, you are very sick, and then it's not even easy to explain to somebody what's happening. Yeah, so it has been really tough for me.
And I went out of pressure from my family, and because they could tell there's something not right with me. So I went back to the same doctor who was treating me for the liver. And when I got in there, I was in a state that I could not go back home. I had extremely high blood pressure of 200 and above. I had low HB clinically, so I was immediately taken for admission. And during this admission, that both were picked, the lupus and the kidney failure. So since then, I've been managing the two. And I went dialysis for 2.5 years and eventually got blessed with a kidney from my younger brother and had a transplant in November 2018. Clinically, I did not have any symptoms, but from my tests, it was serious. The doctors actually had to repeat the test like 5 times to confirm it was really accurate. So as at that time, I was treated for an autoimmune liver disease. After that, I started a lot of symptoms like fatigue, some kind of laziness. I really slowed down. I used to be an all-over person, but starting from that time, I just realized I was not myself anymore. The fatigue for me was key. It is a kind of fatigue that you can't get out of bed. You can't take a shower. You can't actually turn in bed. You can't pick a call. It was a fatigue that nobody understood. A fatigue that I could not even take stairs in my own house. If I go up the stairs, I can take a week to come down. Or when I come down, I will take another before I actually ever go back to the bedroom. I'll be sleeping in the couch because I really have to think about how I'll take those stairs. Funny enough, I accepted out of fuchs. At least there is a name to it. Because even when I was being pushed to go to hospital, I kept on asking, okay, you guys attend, how do I go tell a doctor I am tired? What exactly? Even when I went to that doctor's room with that high BP and everything, he asked me and I said, Doc, I am just tired. I am just tired. So coming from the culture we come from, you're a woman, okay, who doesn't have all what you have? So my acceptance was basically, at least there's something, I can put a name to it. And I have fought everything else. I think also I can prove and I can be in support of all those who've gone through it. I want to fight for those who are going through it. So yeah, that's what motivated my acceptance. I think I'm one person who is very lucky. I have a very large and very supportive team. I have a spouse who is very supportive through it all. I have my kids had to learn about lupus. They will tell you anything you need about lupus.
My case, I started feeling unwell in 2014, and for the whole year, I just kept on taking painkillers, and I thought that maybe it's because I had just had my child, and that's reaction from post-birth complications. I never thought anything about it. It started from my wrists to my shoulder. The pain just started progressing all over my body, and I was taking a lot of pain medications. By the time it reached towards the end of 2014, I had problems getting out of bed, moving, I had fatigue, a lot of stiffness in the morning. Then we just decided I need to go see a doctor. So the first doctor I got to see was actually my child's pediatrician. So when we were there, I told him, I've been taking a lot of diclofenac and I'm still in pain every day. And he told me, no, that's not okay. You cannot just be taking painkillers. You need to know what is going on. So we did blood tests. It came positive for rheumatoid arthritis. That was in January of 2015 is when I was diagnosed. When you have an autoimmune condition, you have to find out what your triggers are. So for me, the one major trigger was sugar. So I decided to cut that from my diet. Then I would eliminate like one food at a time. Maybe I'd get rid of wheat for 2 or 3 months, see how I feel, reintroduce until I got to see what foods trigger the flares. A flare is when your symptoms are more severe than when they are not. So we'd find out. You'd find red meat is bad, you have a flare up. Then you'd try maybe milk, dairy, get on, get off until you find. So for everybody, it's different. Maybe what works for me doesn't work for another warrior. I have interacted with very many warriors, and I know their struggles. Being part of the Lupus Foundation of Africa, I'm a member, and we are, especially during the month of May, creating awareness. We want it to be out there. We want people to know what is happening, what our struggles are, what lupus is. Many people have never heard of it. It's just good to spread the word because there's a misconception in Africa. Not many people have lupus, but that's contrary to what is happening. Maybe it's not been reported enough. Maybe people mashinani are not being diagnosed enough. We need more rheumatologists.
My symptoms showed completely back in 2015 when I went to hospital with some mouth sores, And when I did a full blood count test, I was found to have 2 platelets only, whereas one should have in between 100 to 450. That is where now my journey started. I was not diagnosed immediately, though I spent almost 3 weeks in hospital. The diagnosis of lupus doesn't take a single blood test. It's not like malaria, that you go and do a blood test and then it becomes positive you have malaria. It takes several different types of blood tests. It took me around 3 months to be diagnosed, because in the first place, doctors thought I had something like leukemia, because my blood was not, did not have that component, the platelets. Lupus comes with so many burdens, because it comes with also some other disease overlap, other autoimmune. You can get someone having lupus who has got rheumatoid arthritis or even any other type of arthritis. Unfortunately, in 2018, I suffered an overlap, which is known as a vascular necrosis, which is death of bones on both humerus ends, that is on my shoulders. And I've been having the pains for the last 2 years. They are pains which zinaua, wacha tuseme. But I'm still fighting. Though I was supposed to be going to India in this year, June, but unfortunately I'm not seeing myself going. I'm supposed to do both shoulder joint replacement. But I'm fighting strongly. I would like people to know lupus is a disease and not a decision. Because if it's a decision, nobody will make that decision of having lupus, because it is a disease which has got so many ups and downs. To the supporters and the society, please understand the patients. Don't sympathize, empathize.
You shouldn't give up. You can live for long, a fairly normal life. You'll make adjustments, but one thing I would say is you need to be centered in a belief, whether you're a Christian or a Muslim, or it really keeps you together. Knowing you have some spirituality, you can turn to God, you can pray about it, meditate. It keeps you centered, because a lot can be taken away from you. But with that faith in you, you'll be able to overcome. You'll be able to overcome. You'll have the strength to go on. Then one thing I would say is a support system is very important. You may have that your family doesn't understand, but we have support groups out here. Don't keep it to yourself. Ask your rheumatologist, he'll connect you to other warriors, other patients who are having your same condition. You are not alone. Don't give up. Many people also assume that lupus and RA are for the old. That's the misconception. When you tell people, I have rheumatoid arthritis, oh my, and you're so young, tell them, no, it can even get a small child, even of 2 years, 10 years. It's not a disease for old people.
What I can tell to anybody living with somebody with any chronic illness, it goes a long way. There are times I feel like I want to give up. There are times I feel like I don't deserve it. When I imagine those people who surround me, those people who give testimonies, because every other day I have somebody, Catherine, we prayed for this, Catherine, I went to my prayer group, I went to my Bible class, and I want to fight for them. Even when I no longer want to fight for myself, I want to fight for my kids, I want to fight for my caregivers. Sometimes I know, sometimes I actually tell them they are more sicker than I am, because I am living with that. For them, they have to understand it and live with it, and it's not their load, it is my load. So one thing I always encourage my warriors is, let's appreciate our caregivers and our supporters. Let's make it easier. When times are hard, they are there for us. when we have a better day, let's put a smile on their face.
I'll just tell them to soldier on, not to give up. You just to live like a normal person. You follow the doctor's instruction, you take your medicine, and move on. But you must accept it first, that you have a condition.
Welcome to this special edition of Health Nuggets. Well, May is a Lupus Awareness Month, and to help us shine light on this disease is Dr. Eugene Kalman Genga, who is a rheumatologist at Liberty Arthritis Clinic and also a lecturer at the University of Nairobi. So karibu sana daktari, and thank you very much for joining us.
Thank you for having me. I think it's a good thing because our patients suffer, and I think raising awareness will go a long way to help our patients.
So now getting to our topic of discussion today, lupus. At what point does the body get to now attacking itself? How does this happen?
Okay. So I think it's good to go to the beginning. So lupus is an autoimmune disease. So when we say autoimmune, if we go back to our biology sciences, the immune system is a system in the body that's supposed to protect you from germs, such as bacteria and viruses. But when you have lupus or these autoimmune conditions, for some reason there's a defect in the immune system, such that now the immune system cannot differentiate between the normal cells and the germs. So when that happens, it attacks everything. So now when it attacks everything is how it manifests now as lupus and other autoimmune conditions. Yes. So why it happens, we have a couple of theories. We are still investigating. Partly we believe that your genes may put you at risk. So when your genes when you have a defect in the genes now, it doesn't activate to become the lupus. And what activates the genes, we believe, are things like cigarette smoking, alcohol, some certain infections, in particular viral infections. Even UV light, the sunlight, have been shown to be able to activate the disease. And now, later after the activation, you're going to get the full-blown lupus disease. Yes.
Now, when you talk of the genes, could you say that it runs in families?
There's some authors that say it does that. The thing is, I don't want people to go home saying that if my mom has lupus, I won't get lupus. The thing is, we believe that there's a problem with the genes. So the genes put you at risk to develop the lupus. But what will trigger is what is not known. Though having lupus in the family, it gives a small risk that somebody else in the family can get. And usually they say about 3 to 5%. In the setting of Africa, is a bit difficult because we cannot tell what our grandmothers and our great-grandparents had. Because a lot of time, these diseases are very, very new diseases, especially in the African subcontinent. But in the West, they've been able to show that some of them actually have a family history. I've even seen a couple of people who you find like they may have lupus and they may have another autoimmune condition like rheumatoid arthritis. So maybe a sister has one, then another niece or a sister has the other disease. Yeah.
Okay. And now lupus is a condition or a disease that is really hard to understand, or it's misunderstood and very hard to diagnose.
I think what you've said summarizes everything about lupus. Partly why? Because for a long time in the setting of Africa, our emphasis a lot has been on infections, rightfully so, because infections is what kills people most. Tuberculosis, HIV, malaria, and how it presents is very varied. And we usually say that no two lupuses are the same, meaning that a patient can present as this, another like this. And actually, what I tell my students is that it's like a hydra. A hydra meaning it has many faces. So depending on what time the patient is found, the diagnosis might change. I'll give you, for example, I've seen a lady who had come with low blood. We call it anemia. And after so many tests, they called us at the end when they said, okay, let's call in the rheumatologist. Maybe it's something to do that line, either being what? Lupus. We have also seen patients who come with unexplained fever and joint pain. So they've been treated for typhoid, malaria, but eventually when you see them, it is lupus. We've even seen the unfortunate case of, I've seen the one lady I saw who had lost 6 pregnancies, which I thought was very, very wrong. That somebody could have those many pregnancy losses before the diagnosis of lupus was made, because lupus can put you at risk to develop a pregnancy loss. Apart from that, kidney problems have been associated with lupus. I think there's some famous people, take for example like Selena Gomez, who had a kidney transplant. I think even Nick Cannon had some kidney problems. He's a rapper, he's a singer, has some kidney problems. So as you can see, the presentation is very varied. So if you're not keen as a clinician, some of these things can be missed. And it shows because if you look at the studies you've done locally, the time to diagnosis is very long. Actually, one research has shown most of the patients one patient had actually been taken 13 years to get diagnosed. Yes. If you compare with the West, it takes about 6 years, but still that's a long time to be unwell. Yes.
And you've said that it might mimic malaria, typhoid, and anemia. As a doctor or as someone who's in this field, when a patient comes, what are some of those signs and symptoms maybe that you can just look at them and say that this is lupus without them going through all that process with diagnosis and all that?
So I think the take home is that diagnosis is not easy. That's the first thing. I don't want people to say at home that my doctor took a long time to diagnose me, but diagnosis is not easy. But some of the symptoms that if you have may suggest lupus, like are prolonged fever, weight loss. There's a butterfly rash. Actually, the name lupus is coined from a Latin word meaning wolf bite, because they'll get a rash here. Actually, it's a cheek, like a butterfly rash. Other things that may suggest lupus, if you have a lady with fever, joint pain, the skin rash, other symptoms like, for example, like now we're approaching our winter in quotes, we have something called Raynaud's. So when what Raynaud's is that when it gets cold, the hands become very white and painful. That may suggest you have lupus. Other things that may suggest you have lupus is recurrent pregnancy loss. And to be specific, within the first 3 months, called the first trimester. If you have a recurrent pregnancy loss, it may suggest, yes, it may suggest that you have lupus. But the way we diagnose lupus is not just on one particular sign. We usually have a diagnostic criteria, it's a calculator. We put all the symptoms together, we put it there. If you get a certain score, is when we say definitely this is what? This is lupus. Yeah.
And does the rash come immediately you start getting these symptoms? Now,
the interesting thing about the rash is that not everybody gets it. That is the interesting thing. Because I know a couple of patients who diagnosed lupus who don't get the rash. Majority get, and usually, especially in the setting of Africa, it's a bit difficult because we are black skin and everything. The white population is a bit different. But here, the rashes in particular are very common during the sunny weather because the sun has something called ultraviolet light, which burns the skin. On burning the skin, certain chemicals are released that can activate the lupus. So the patient will tell you, I have a rash here that maybe is itchy. And I go out to the sun. Sometimes they can even get like a rash on the skin. We call it like an allergic heat rash. So I tell you, maybe when I go to Mombasa, I itch a lot. And most of the time they'll think, maybe because it's just Mombasa weather, it will do what? It will end.
And what of the mouth ulcers and the swelling of the hands?
So mouth ulcers is another common presentation. Apart from that, you can also get genital ulcers. Swelling of the hands is because like this disease is multi-systemic. So it can present the painful, swollen joints, in particular of the hands and the toes. Apart from that, you can also get muscle muscle weakness. You can get even hair loss. Sometimes you can get swelling of all of the body. Take, for example, if you have a kidney problem, your legs swell and everything. Even the heart can be affected. So as you can see, it has very, very, very many faces.
And of course, as you've said, it mimics a lot of the...
Yes. And like that's the challenge we have sometimes, because if a patient came with persistent fever, in our setup, the first thing the doctor thinks is infection. If a patient comes with fever, weight loss, hair loss, some ulcers, the thing they'll think about first of all is HIV. Yeah, and actually some patients I've seen who tell me, Daktari, if you send me for another HIV test, I'm not coming back here because I've been tested 10 times. If you want to test me that, tumekosana.
So, like a case you just heard from a guy called Carlos, he says that for him, the first time he went to the hospital, they actually tested him of HIV, negative. Then the second time he came again, they tested him of HIV because of the same.
The same, because like you see, like some of the symptoms are very, very similar. I'll take for example, with HIV and lupus, you'll get hair loss, you'll get weight loss. If you have a chest problem, you'll cough. Sometimes can give you diarrhea, which is both sides. You can get low blood. As you can see, it's very, very, very similar. And the doctor at that time was justified to test for lupus, partly because, and one thing that made justify because lupus is more common in women rather than men. Actually, the ratio is about 9-to-1. So they are a bit justified. But doing the second time, I don't think it would have added that much benefit. But like you can see, that those are some of the stories which the patients tell us when they come to see a specialist.
And you talking of it being common in women, and just from the research I did, it's even more common in colored women than men, than
the whites.
The whites, yeah. Why is that?
We about the race disparity, we are not sure. We are not sure. There are a lot of theories here and there. What we do know about, when you speak about the race, is that the blacks have it worse than the whites. That one is been confirmed in terms of the disease severity and everything. And part of the reasons they say is that maybe late diagnosis and all that could contribute. In terms of why ladies get it more than men, we believe there may be a role of estrogen. And actually, if we look at the numbers for lupus, majority of the people are in that age-bearing age, and actually before menopause. After menopause, the chance of getting diagnosed with lupus actually goes down tremendously, up to almost 50-60%. So we think there may be a role of estrogen in terms of in the science behind the disease of called lupus.
And now, even as the country continues to battle COVID-19, from the lupus warriors that I've talked to, most of them are really finding it a challenge, especially at this time. What can be done as far as maybe the course of treatment and medication is concerned?
Of late, we are having challenges with this drug called hydroxychloroquine. And partly because it was announced in March that it's a game changer, that it treats COVID virus and everything. But if you look at the data, we've interrogated the data again, the evidence is very small and it's very, very limited. In fact, we cannot conclusively say it does treat corona. The problem now is that when the announcement was made, either the people hoarded, the pharmacy companies, or people bought up all the stock. Yes, so now the people who are suffering are our patients. And hydroxychloroquine has been shown to be beneficial in lupus. So I'm just praying that with such kind of platforms that we tell Kenyans and people watching this show that it hasn't been proven. Please leave the drug for people who deserve it. Yes, and they are really suffering.
Now let's just go back for pregnant mothers. You just mentioned that there's pregnant mothers with lupus are more vulnerable to miscarriages and all that. Let's say I have lupus and I would really love to have a family. Yeah, how does someone go about this?
So, because lupus patients are high risk, especially when they get pregnant, because one, some of the drugs are not compatible with pregnancy. Two, if you have things like kidney problems, high pressure and all that, the risk of miscarriage is higher. Okay, so usually if you want to get pregnant, it's always good to sit down with your rheumatologist, sit down with your gynecologist, and come up with a plan. And most of the time, the plan will involve the following steps. The first thing is that you must be stable at least 6 months before you conceive. Stable means no flares. Like if you have kidney problems, it's quiet and everything. The second thing is that the medicine that you should be on should be baby friendly, because certain medicines, take for example like methotrexate, a drug called mycophenolate, are not compatible with pregnancies. Another drug called prednisone in high doses is not good for pregnancy. So you try and taper or reduce the lowest dose that you can do. The third thing is that there are certain medicines that have to be on the regime if you want to get pregnant. To be specific, a blood thinner and hydroxychloroquine. Because the science behind lupus and pregnancy is that there are certain, we call them antibodies. So antibodies, for those who didn't do biology, if you get an infection, the body's response is produce antibodies. So lupus has a lot of those antibodies that attacks the body. So these antibodies can cross from the baby to the mother. I mean, from the mother to the baby, sorry, and cause lupus and can cause death. So the drugs that you're put on usually lower the chance of transmitting these antibodies. And this should be done in consultation with your doctor and your gynecologist.
So Daktari, thank you very much for joining us today, and especially for just allowing our audience understand more about this disease and also empathize with those that are living with lupus.
Thank you for passing by. Like I always tell my patients, knowledge is power. And I think raising awareness for this disease will go a long, long way.
Thank you for finding time and joining us on Health Nuggets today. Let's keep this conversation going so that we will make as many people as possible understand this condition. And if you have this condition, it's not the end of the world. Because as we've heard from other lupus warriors, it's only you who can detect where this goes. I would like to thank the caregivers of lupus warriors and each and every other person that made this their story today. If you missed any part of this discussion or have any query about today's show, just feel free to reach us on our social media handles as displayed down below on your screen. Let's do this again next week. Until then, take care. My name is Aida Muzati, but always remember that your health matters.